Good afternoon. I'll call the Board of Health meeting to order at 4:46 p.m. If everyone would please rise for the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Okay. Up first is the discussion of upcoming food permit and tobacco permit renewals. Camille.
Okay, I didn't realize that was the first on the agenda. That's fine. So we are heading into renewal season. Amanda, next month, will be sending out reminders to all of our food establishments. We're also going to be separating our food and tobacco permit applications and actual permits. I think we only have about 10 or 11 tobacco permit or tobacco establishments, so they will be getting a separate letter indicating their tobacco renewal. But we are on top of it.
Beautiful. And our food permits all look like, you know, the application, everything looks good to you. I think you had gone over them.
So yes, I think we're going to be fully online.
Yes.
Yes.
Wow. Beautiful.
Yeah.
Okay.
He's made it.
Excellent. Yay. All right, perfect. Thank you.
Welcome.
Okay, up next is updates on plans for the next bike rodeo. Do you want me to?
No, so I had followed up with the PTO. I talked to Kim last week. She had some suggestions. I told her how we were going to go to the Apple Festival, and then we were hoping to go to not trunk or treat. What's the Spooktacular here, and then the Christmas one to kind of get reminders, save the date type of thing. And she said it would be a great idea if we could go to the Trick or Trunk that they have. It's at Dudley L on October 16th from 11:30 to 2:30. Even if we just did a table where we could talk about saving the date, etc. And she's like, there's an area, I have never gone, there's an area where they do games and stuff. She goes, maybe if you guys set up there, because they pull in a ton of traffic, we could pass out our information. I'll give her a flyer, and she said she'll put it on their Facebook PTO page, and they'll get the word out for us. She also said maybe if we brought helmets to give out, that would be a way to get people to come. And I said, all right, I'll talk to the board. She knew our meeting was today. They have a fall festival page too that gets tons of hits, so they're going to advertise on those two spots for us. I sent you that flyer in the email. I wanted just you guys to take a peek at it, see if you're okay with it, and I'll share it with her if there was something that I forgot. She also said maybe if we called Head Start in Webster, because they do a lot of, they have a lot of families in Dudley, so that might be another thing to reach out to them. The only thing, if we go to the Trick or Trunk, if we could bring candy, because that's the donation. She goes, I know that's not healthy. And I said, I don't think that's a huge problem. No. So last year they had it. She said they based it off how many pieces of candy they gave out, and it was anywhere from like 1,500 to like 1,800 people that came. She's like, so you're gonna get a lot of traffic.
Okay.
And what time was that?
11:30 to 2:30 at Dudley L. So we probably have to get there like around 10-ish, 10:30 to set up. I told her we just need a table. We'll bring a table and our pop-up, and then a sign that just says Board of Health and some ideas. So I printed these up, and I thought we could put those on. Want me to just keep going with all my stuff?
Yep.
In addition to handing out those there, I thought we could also bring COVID testing kits that we had, and we can put those on there. And then when we go to town meeting, we could do it there as well with those on there. So I was like, okay, well, that sounded like another way to get everything out. She'd also make sure that she got the word out through the school.
You want to put the day of the week,
though? The time keeps deleting after I, when I put it on there, so I don't, I'm like, no, of course not. So.
That's great though, Ro.
I think.
Yeah.
I was like, oh, trunk or treat, that's a great.
That's perfect.
And those are all school family kids.
And that's my Saturday off, so I certainly could be there to help.
And so we would need roughly 2,000 pieces of candy.
Well, no, not just from us. We would have to bring our own donations. Because everyone brings.
contribute.
That's what I mean, but I'm saying,
yeah.
they said they had like 1,500,
Yeah, so everyone that goes.
you give out a piece of candy.
So it's
that-
not, wouldn't just be us, you know.
No, but I'm just saying, they
Yeah.
said they had like 1,500 people
Yeah.
through there, so we'd need to 1,800, you'd wanna have like 2,000
Right.
just in case.
Yeah. So, I mean, you know those big bags that you can buy, like I figured if we each brought one, then that's our donation from the Board of Health.
Oh, no, absolutely,
know,
I just wanted to
not a
make sure we have
problem.
enough.
No, well, it's not gonna just be ours, every
Right.
teacher that
Right,
comes
right. No,
and
no.
sets up,
Yeah.
and so they'll bring some too, so hopefully, she's like, we've never run out, but, I'm like, oh, well.
Not a problem.
All right, already
So-
on my calendar.
I was like, yeah, I told her after tonight, I would email her to kind of give her an update after our
Absolutely.
meeting. In addition to bringing this with us to the town meeting, I thought we could start advertising a little bit on the flu. So I found this, it's a little bit bigger than these small things, but if we pass these out to people that walked in, we could also just kind of put the bug in people's ears about flu season coming. I did finally hear back from the vaccine unit. The only ones that they give you for free are if you're 19 and younger and have no insurance. And that's the only ones they'll give you. We can purchase our own, and then we could have a clinic, and then we could bill people for the vaccine. I did sign up for through the manufacturer of the vaccine, just to kind of get a sense of how much it costs. It won't tell you unless you sign up, and then they verify, like, so as a nurse practitioner, they're gonna verify my number. Once they verify all that, then they'll email me back, so I can log back in and get a price. So we could potentially do our own, but I don't know. I called Walgreens, but I was on hold forever yesterday, so I'll try again, because that was the other option. We could call like Walgreens or CVS. They can purchase the vaccines themselves, and then they'll come out and do a clinic for us. So that's the other option. I did reach out to the schools to see if there was any interest in like a clinic for the kids or the staff. This was prior to finding out that there was restrictions on the vaccine, and the nurse leader was like, right now no families have said anything about the flu. So I'm just gonna leave it alone for now. If they reach out, then we could try, but I think it would probably be a little bit easier for all of us if we had one of the pharmacies come out. They'll tell us the date, pick the time that works for all of us, and then we could have it downstairs if we wanted to, so.
Absolutely.
That was it. Does anything else you guys think that I forgot about, reaching out to people about saving the date, and anything else you want me to add on the
Okay.
the flyer?
I did speak with Sergeant Popowski about
Okay.
the bike rodeo. Told him the date and the time and the reasons why we were considering it. He thought that was spot on. Great idea. He's all for that. So he's aware of everything, and he's going to be doing some contacts on his end,
Okay.
you know. And then I did reach out to the Grange regarding the Apple Fest. We do have a table.
Oh, good.
We have to bring our own table. She
Okay.
asked if we could. I said that would.
October 3rd.
October 1st from 10 to 3, and we can get there as early as 8 to set up. We can bring a pop-up if we want. The space is 10 by 10. And they're overjoyed to have us there.
Okay,
So
I can do that.
that'll be great.
Kind of the same thought, bring the same things that we're talking about.
Absolutely. Yep.
Alright.
I think it'll be great, you know, just have some little stuff and
Yeah, we were thinking also, if we do get the masks and the gloves and everything, that we could bring some of the masks to donate at the festival and then town meeting. And that's if we get them, right? Because it's first come, first serve.
Yes, so I was gonna talk about that.
Yeah, all right, so I think that was it that we wanted to really talk about.
Yeah.
And the last thing I'll do for the bike rodeo is reach out to that company that you sent me for the sunscreen. They were full this year,
But catch them
but
early.
I'm gonna
for
catch
next
them
year.
early, see if
Yeah.
we could get.
Absolutely.
That was amazing, like, the
Yeah.
offer that they were giving.
Yeah.
It'd be worth trying to pursue
Perfect.
that.
And really nothing on COVID on my end, like all of a sudden, like the cases just kind of went down.
Oh, wow.
Yeah.
From last month, they were really high, that was high all of a sudden.
Right.
And right now, they're, I think I had like 10 so far, so.
Maybe,
I've
so
seen
that
the
was like
last
the
couple of weeks.
back to school rush is done
I
now.
was like, geez, I
Hopefully.
hope so.
Yeah.
I've
knock
only
on
heard
wood.
from one school nurse, she wanted to know, in the past, like last year, they would let us know how many they had, and I said, I don't need to know that now, so, yeah.
Perfect, great. So Camille, we'll move on to you.
Sure. So mine kind of ties in with Rose. The state had announced a couple weeks ago, like 3.5 million rapid at-home tests were getting distributed to municipalities across the state. Dudley has accepted the full allotment that they are allocating for us, which is 5,940 tests. So 5,940. And that's tests, and then it's divided by 2 because it's 2 per kit. So it's about 33 cases, boxes, that we're getting. Deliveries will be made on a rolling basis between mid-September to mid-October. So we'll get them when we get them. And we had requested additional free PPE, including adult surgical masks, children's masks, KN95s, and some Band-Aids. Each of them had a minimum of 500, except for the Band-Aids, had a 500 minimum order, but it's on a first come, first served basis. So I don't know where we stand on all of those, but we might get some, we might not.
Beautiful. Hey, we'll try for anything.
The only other update I have is that the regional grant, we are in the process of finalizing our replacement community health coordinator. So that is expected to be filled by the end of October.
Okay, good. Any questions for Camille? Excuse me. Okay, up next, approval of the minutes from August 30th.
I make a motion to accept the minutes from the August 30th, 2022 meeting.
I second that.
I have a motion and a second. Any other discussion? Seeing none, all in favor? Aye.
Aye.
Passes unanimously. And public, so do you have anything? No public, sorry. Any, do you have anything else to, board comments? Anything else to add?
I think the only thing I was thinking of for moving ahead was the time of our meeting. I don't know if we wanted to kind
It's
of
a
move
struggle
it.
for me to get here for 4:30. That's why it's, I'm open for, you know.
So the next meeting we tentatively is October 18th. That's the third Tuesday. Excuse me.
No problem. Even if it's by a half an hour.
Okay.
I don't know. I know you guys are already here, and I hate to make you.
So 5? Do you want to?
It's less stressful. I get here the earliest is like 4:45, so.
So do you want to aim for 5? We'll try the next one at 5.
I'm good with that. Certainly makes it a little less like, here, your nails are gonna dry, I gotta go.
Yeah, we will.
Okay.
So October 18th is good. What?
Yep. I
So
lost
October
the meeting.
18th, 5 o'clock.
5 p.m. Okay,
All
perfect.
I'm sorry.
Do you have any board
It's
comments?
a little easier.
Nope.
Okay.
Not right now.
Amanda, anything?
No.
Okay, I just have a
The system.
couple things that will, I'm reading all my notes. So we did go out and have a meeting with he's not so new anymore, he's been here for a year, but the
Right.
president of Nichols College. Yesterday, we reached out to him to set up a meeting. We wanted to thank him for when he opened the cooling centers in town.
Okay.
And we just wanted to establish a relationship with him, where Ro had such a relationship with PJ, who was there, she was the dean of students, and she's no longer there. So we wanted to reach out and kind of make sure that he had a face to the names and
Good idea.
just make him aware of what our
Role, position.
right and what we're looking for from the college and what he's looking for from us. So
Right.
it was a good meeting. Yeah, it was very, very nice, so that went very well. I think that's it. I had the Apple Fest, and then the town meeting is coming up on October 24th. And then the last thing that I wanted to do is we worked very closely with, well, you worked even more closely with Nichols College over the past few years through the pandemic and everything. And one of the women's that you had contact with was Kathy Nicoletti. She was the director of health up at
services.
Nichols.
She was a nurse.
Yes, and she passed away suddenly on Friday. And we just want to send out our condolences to the entire Nicoletti family. She was wonderful to work with. She, you know, very, very caring person, and she had that health center operating very well, and we did have a lot of contact, so we do send out our condolences.
Very sad.
Yes. So that's all I have.
I make a motion to adjourn.
Second that.
I have a motion and a second. Any further discussion? Seeing none, all in favor?
Aye.
Meeting adjourned at 5:02 p.m.